Hello, this is Amy Smith with the ANA and the BCNS, and today I'm here to discuss the CNS pathway, specifically for the Northwestern Health Sciences University. Today, we're going to do an overview of the American Nutrition Association. We're going to talk about the benefits of the Certified Nutrition Specialist. We're going to talk about the CNS pathway and a little bit about advocacy. There are 4 pillars of the American Nutrition Association. We focus on educating, certifying, advocating, and connecting. The first pillar, educate, we have a CE content membership or a continuing education content membership that is available to professionals and to students. We also offer ANA trainings, which focus on personalized nutrition, ketogenics, and nutrigenomics. We offer 4 certifications: our flagship certification, the CNS, which we're here to talk about today, our CKNS, which is the Certified Ketogenic Nutrition Specialist, our CNGS, which is the Certified Nutrigenomics Specialist, and the CPNP, the Certified Personalized Nutrition Practitioner. At the ANA, we also focus on advocacy. It is our belief that all nutrition professionals should be able to practice to their level of training and expertise. And finally, we work on connecting. We have a program called CNS Connect, which helps to bridge the gap for CNSs that they have between their degree program and their supervised practice experience and becoming a CNS. We have CNS candidate support that is offered through these type of webinars, as well as through a Facebook group. We also have our content membership, which is available for students, and we offer networking events that are virtual and in person. So let's talk about the CNS. What are the benefits of getting the CNS? First, the CNS is a certification. It signifies that an individual possesses the knowledge and skills required to perform a certain set of competencies, in this case, personalized nutrition. It sets the standard for a given discipline and focuses on the 3 E's: education, experience, and examination. These 3 E's are very important because it's usually the area of which advocacy is focused. The CNS is accredited by the National Commission for Certifying Agencies, or NCCA, which evaluates credentialing programs against their defined standards and accredits programs that meet those standards. So this is something that is extremely important when you're looking for a certification. It creates credibility with regulatory bodies, both state and federal, professional groups, the public, insurers, and other stakeholders. It is a trusted third-party verification. It demonstrates that we perform psychometrics on our examination, and it supports certificates in the profession with state licensure issues. There are several different career paths for the CNS. So we do see a lot of CNSs going into private practice, working in integrative clinics, writing, blogging, and doing podcasting. They can also go into teaching, which could be in academia or in research. We do see CNSs that are sitting on licensing boards and nonprofits. Some CNSs will focus on research, specifically with supplement companies, and a lot will focus on community nutrition, culinary nutrition, and group programs. The CNS pathway has 3 components: education, exam, and experience. We're going to talk about each of these in detail. The education requirements, there's a degree and a coursework requirement. The exam is a 200-question multiple choice exam. You have 4 hours to take it. We offer it twice a year. And the experience is 1,000 hours of supervised practice experience that must be done with a BCNS approved supervisor. We'll talk about each of these components. First, the degree requirements. So all of our CNSs have to have a master's or doctoral degree in the field of nutrition or a related field from a United States regionally or institutionally accredited college or its foreign equivalent. And we also do allow doctoral degrees in the field of clinical healthcare that are not limited to DCs, ODs, doctors of nursing, NDs, and PharmDs. Aside from the degree requirement, there's also a coursework requirement. So the coursework must be from a United States regionally accredited or institutionally accredited institution. And there are 36 semester credit hours required. So these are going to be in a different group of categories. So the first requirement is 12 credits of graduate level nutrition. Here's some examples that are within the degree program at the university that would fit into this category. So we have foundations of functional and integrative nutrition, evidence-based nutrition, natural therapies, and your nutrition capstone. So all 4 of these fit into that graduate level nutrition category. We have, excuse me, biochemistry. So 6 credits are required. This can be at graduate or undergraduate level. So within the program, it might be that you're taking nutritional biochemistry, and also there's a prerequisite for the program. So you should come into the program already with 3 credits in biochemistry. The next requirement is anatomy and physiology. So this can be graduate or undergraduate level, and this is a prerequisite of the program. So you should come into this program with this course already being completed. And we do accept anything from undergraduate degrees that are accredited. The next category is clinical and life sciences. So we require 12 graduate or undergraduate credits. Some examples of this could be organic chemistry, intro to human biology, nutrition, wellness, literacy, and an intro to nutrition course that you've taken at the undergraduate level. The final category is behavioral science. So this can be graduate or undergraduate, and we require 3 credits. So foundations behavior science fits into this category. Also, any undergraduate classes of intro to psychology, intro to sociology, those would also fit into this category. So once you've completed the first E, which is education, you can move on to the next one, which is examination. So you can take the exam anytime after you've finished your degree and your coursework. We do require that you complete an application that's due about 2 months before the exam happens. So usually the exams are in June and December. There's a $100 non-refundable application fee that you pay when you're ready to apply. You will need to submit a coursework form, your official transcripts from your schools, 2 letters of recommendation that are emailed directly to the BCNS by the writers, and your resume. Once approved for the exam, you then pay a $400 exam fee that's paid in your candidate portal as well. And then the tests are administered via test center. So there's an $83 fee that is paid directly to your test center. The exam happens twice a year, like I said, usually June and December, and it's a 5-day period that you have to take it in each of those times allotted. So if you take the exam in December, it's usually the first couple of weeks. Same thing in June. So depending on when you decide to take the exam, make sure you check the website to see when the exam period is and also when applications are due. So moving on to the third E, which is experience. We call this supervised practice experience. We do require 1,000 hours and within 3 categories. Category A is personalized nutrition assessment interpretation. Category B is personalized nutrition intervention, education, counseling, and ongoing care. And category C is personalized nutrition monitoring and evaluation. So I'm going to talk about each of those in detail, but you do have to have a minimum of 200 hours in each of those categories. Time with your supervisor does count within your hours, and the remaining hours can be split up into the categories however they fit. You do have to use our provided candidate report to track the hours. So make sure when you start your hours that you're familiar with that document. We do have some tutorials online to help you understand how to fill that out. The goal of the SPE is to address the competencies which are laid out as part of the overall experience. It's flexible to meet your career goals, and it also works to meet licensing statutes and regulations. So our paperwork was created around the requirements of different states that have licensure. You can begin your SPE once you're matriculated or have started your degree program. We do suggest that you don't start working directly with clients until you've finished at least your foundational nutrition education. You have to complete the SPE within 5 years of passing the exam. And you can use multiple venues and supervisors during your 1,000 hours. There are 2 different types of experience. The first is direct experience. There's a minimum of 750 hours required in this area. And direct experience occurs as the candidate becomes more experienced, and more of the hours will be spent directly with a client or groups of clients in preparation for client work. So the things that count within direct experience are counseling individuals and groups, activities directly related to the counseling of individuals and groups. So this would be chart notes, treatment plans, evidence-based research that is directly related to that case, communicating with clients, and also communicating with the client's healthcare team. Participating in community education, including the development and delivery of education to a specific population, and anytime that you spend with your supervisor. So this could be grand rounds or one-on-one meetings. I do want to mention in the community education category, if you are in Florida or plan to be licensed in Florida, They do require 200 hours of community education as part of your 1,000 hours. So please reach out to the BCNS. I'll provide an email at the end of this presentation. Please reach out to us and let us know that you are in Florida so we can connect you with someone to give you more details on that requirement. Also, if you're in North Carolina, also please reach out to us and we can provide you an email for our state mentors, because North Carolina does have some requirements that they require for tracking your hours. So if you're in either of those states, let us know. We can put you in contact with somebody who can provide some guidance. Next, we have indirect experience. So this is an optional part of the experience. You do not have to have any indirect hours, but the most that you can have is 250. And so indirect experience happens when you are not directly providing client care or interventions. So this might be things like listening to videos of clients and practitioner interactions, discussing findings with a supervisor, shadowing your supervisor or an experienced clinician, participating in simulation activities or role playing, and utilizing case studies to analyze client cases. So in these activities, you are not working directly with a client. And usually those that participate in indirect hours, we're going to do those before the direct hours. This is your opportunity to get to see how other practitioners or supervisors are doing the work. And so this is a great place to start, especially if you do not have any experience with client care. Again, you can only get up to 250 hours of indirect experience. So within the degree program at the university, there are a few courses that you can take as electives that can count for indirect hours. So those are listed here. If you are taking any of these classes or have taken them, please reach out to Dr. Hope and she can provide guidance. But these are courses that you can use as electives that don't count towards your 36 hours that you need for the exam. I'm sorry, your 36 credits that you need for the exam. So these would be extra that you could count hours towards your indirect experience. The following activities do not qualify for SPE. So research that's not related to a current client, so research for the sake of researching may be a great way to study for the exam. It might be a great way to market for clients, but it doesn't count for hours unless it relates directly to a client case. Writing books, articles, and blogs, teaching classes in an academic program or setting, developing condition-based training programs and treatment protocols that are not related to a current client. So an example of this would be a program about, for example, Hashimoto's that you want to create. Again, that might be a great way to get clients and a great way to study for the exam, but it does not count for hours if it is not related directly to a current client. Presenting educational lectures, videos, webinars, for mass audience. So this might be something like doing a Facebook Live or a YouTube video. Again, a great way to get clients, but it's not going to count for hours. And you can't watch educational lectures, videos, or webinars to earn hours either. So category A is personalized nutrition assessment and interpretation. So think about A as assessment. So this is going to be everything that you're doing initially with that client. So you're going to be looking at their paperwork. You're going to be looking at their diet, lifestyle, behavior, symptoms, nutritional genomics, their biochemical laboratory markers, if they've turned those into you, their family history. So you're assessing all of that. So this is the time that you're looking at the paperwork, you're doing that initial session with them, and you're assessing the overall situation. So this is going to be that initial consultation with the client. It might also be the time that you spend doing a discovery call where you're trying to find out if they're a good client for you and you're a good practitioner for them. That would also be part of the assessment category. Category B is intervention, education, counseling, and ongoing care. So this is going to be the time where you're creating that treatment plan. You're doing research on their medications. You're developing their MNT interventions. You're providing education for them. Maybe you're making a handout about sleep. Maybe you're doing food prep instruction or taking them on a shopping grocery store tour. All of these things are the education and counseling of that client. Those are going to be category B. So think about this as when you're creating the protocol, you're creating the things that will go with the protocol and anything that has to do with education for that client. And category C is going to be the monitoring and evaluation. So think of this as your follow-up activities. So they're going to come back to see you again, you're going to reassess, you're going to maybe change things based on what they reported to you. And so think of category C as your follow-up. I always get the question of, okay, what if they bring me lab work to a follow-up, and is that category A or category C? It could technically fall into either one, so feel free to choose either one, but not both. So if somebody's bringing lab work to you and you're reassessing it, or you're assessing it, even though it's a follow-up, you could count it in category A. There's a little bit of wiggle room there. Just make sure you're only counting it once. So how do you find a supervisor? So the best way to start is to reach out to us and get a list. So we list supervisors by state. Also, we have where some of them are licensed, so they don't necessarily have to live in your state. That most of the supervisors do their work virtually. What you do need to consider is if your state requires a license to practice, your supervisor will need to be licensed in that state. So for example, Maryland requires a license to practice. So if I live in Maryland, then my supervisor will need to be licensed here. So you'll need to make sure you're aware of your state laws, which we'll talk about in just a moment. But that'll be part of one of the considerations of looking at the supervisor list. You may also want to evaluate it based on the area that they work in. So if you're looking for a certain niche or a certain specialty, that might be something to take into consideration. You can also look within your work setting. So if you already work in a clinic, you can see if somebody there would meet the requirements. So we do have certain requirements that they must meet, and those are available on the website. More or less, they have to have a master's degree or higher in nutrition and 3 years of experience. So if it's an MD or a DO, they can apply to be a supervisor. We do require some extra nutrition education. So just make sure you check out those requirements online. And always make sure you have your supervisor approved before you start your hours. What you don't want to do is complete some hours and then find out they're not approved, and then we wouldn't be able to accept them. So number one rule, don't start those hours until you're working with someone who is approved. There's different settings that you can work in. It could be clinical, it could be a community setting, an institutional setting, home health. We have had candidates do an internship or residency. It could be any combination of these. So it's meant to be very flexible and kind of work around what your goals and depending on what state you're in and your supervisor, what you're trying to reach. You can start your supervision once you're matriculated or begin your degree program. It is best to start with the indirect hours, especially if you don't have any experience working one-on-one with clients. And if you're still if you're still going to school and earning your degree, we do suggest that you complete those foundational courses before you start working with clients. Most of the time, supervisors are not going to start accepting candidates until they're in their last or second to last semester of their program. So depending on who you're interested in doing your SPE with, they may have their own rules about that. So just make sure you're communicating with them. And we do see that people do better on the exam once they've completed most, if not all, of their SPE hours. So it is not required. You don't have to complete all 1,000 hours before sitting for the exam, but we do see people do better because it is a clinical-based exam. So as far as documents for the SB, we have on the website, we have a supervisor approval application. So that would be for someone who is new and not already approved. The supervisor is going to submit a supervisor report on your behalf at the end of the hours. We also have a checklist that's available in the candidate portal. We have that form that you'll need to track your hours and a couple of tutorials that are available. If you can't find those on the website, please reach out and we can direct you to those, to these different forms. So let's talk a bit about advocacy. So the ANA really focuses on advocacy at the state and federal levels. We work on legislation and rules and regulatory processes. And our main goal is to create pathways to licensure for our CNSs and to provide adequate exemptions for other nutrition practitioners. So as I mentioned before, we believe that all nutrition practitioners should be able to practice to their level of education and training. And we believe that everyone has a spot at the table. And so when we're advocating, we're really focused on that. And we really want to also work to expand economic opportunity. So things like insurance reimbursement. Currently, of the 53 U.S. jurisdictions, which includes DC, Guam, and Puerto Rico, CNSs can practice some level of personalized nutrition counseling in 46 of those states. That doesn't necessarily mean that we can practice medical nutrition therapy. It means that we can practice some level of nutrition counseling or nutrition education. So please make sure you are familiar with your state laws. 19 states have licensure or a certification pathway for CNSs, and a few remaining states have outdated or antiquated laws in which we absolutely cannot practice. So there are 7 states that we absolutely cannot practice in. Those are listed on the website. So please make sure you're looking at that to make sure as you're in your degree program, you know what you can look forward to as far as state laws. There's usually two types of regulations. We have exclusive scope, which is usually the states that have a license, which means that a license is required to practice at least some aspect of nutrition and dietetics. So this term medical nutrition therapy, you know, that's what is used most recently in laws. It's not in every law. But most states are saying that most states that have this exclusive scope statute are going to be requiring you to have a license to practice medical nutrition therapy. So examples of that in North Carolina, New Jersey, North Dakota. There are also exemptions or exceptions, that's what it's sometimes called, that are eligible in some states that allow CNSs to practice. So Georgia is a good example of this. So there is no pathway to licensure for CNSs in Georgia, but there is an exemption that says if you have a master's degree in nutrition, you can practice. And so in that state, that's how CNSs are able to practice. There are also non-exclusive scope states. So these are the states where that certification of that licensure is usually a bit more volunteer. It's not required. So examples of this would be Alaska, Connecticut, West Virginia. So you don't have to necessarily have a license to practice there, but you would need a license if you wanted to accept insurance. Again, it's not required, but it does open you up to more possibilities, especially if you're looking for jobs in those regions. And then there are some states that have no formal board. So for example, I'm in Virginia, we have title protection. So you have to have your CNS or your RD to call yourself a dietitian or a nutritionist, but there's no actual regulation or licensure in my state. And then there's only one state that has no regulation at all at this point, and that is Arizona. So here's just kind of some insight into what that looks like. So on the left are those exclusive scope states I talked about. So these are states where you are going to have a license to practice. If you live in one of these states or plan to practice in one of these states, you're going to want to make sure your supervisor is licensed in that state. So remember, when you're doing telehealth, you have to follow the laws of the state where you are located and the state where your client is located. So I'm in Virginia, I don't have to have a license, but if my client's in Maryland, I do have to have a license in Maryland to see them. And if I am a candidate in one of those states, then my supervisor needs to be licensed in that state. The non-exclusive scope states on the right, those are where it's more optional. Again, I would suggest that you look into licensure in your state if you live in one of those, but your supervisor doesn't necessarily have to be licensed in that state for you to practice. And again, Virginia is the only state that just has title protection. There are some advocacy tools available on our website. Again, if you're unable to find these, let us know. We're always working hard to update them. So please reach out if you have specific questions about your state. And all questions can be directed to certifications@nutritionspecialist.org. We're happy to help you with anything that comes up if you have questions about the exam process, application process, or advocacy. Thank you so much.